All right. Good morning. My name is Megan Ressler. I work in the Cancer Education Center in Rochester, Minnesota at Mayo Clinic. We're joined this morning by my colleague Janine Kokel and Angie Murad, and Janine will do an introduction of Dr. D'Andre in just a moment. So we're happy you're here to learn more about medical cannabis. Just so people know, we're recording this session for viewing. We are appearing on screen, but you are not. But we want this to be available to people that aren't able to join us for the live. So you can view it again later or share it with other people that you think might find the information interesting that we're sharing today. We'll have our presentation and then allow some time for questions and answers at the end. There's a Q&A chat function on your screen. So if you have any questions for us, we encourage you to type those into the chat and we'll see which ones we can get to before our time ends. We would also encourage you to like and follow the Cancer Education blog on Mayo Clinic Connect to learn more about upcoming webinars that we have. Topics that we're having coming up soon are Tai Chi, understanding your blood counts, and acupuncture. There's also lots of educational resources and a social component to Mayo Clinic Connect. So if any of that interests you, I encourage you to check that out. And then we want people to know that today's session is informational, not intended for medical advice, and that cannabis laws, whether they're dispensed for medical use or not, varies state by state. So you may need to do some homework based on where you live to find out more in that regard. So Janine, I'll go ahead and turn it over to you.
Thank you. It's my pleasure today to introduce our speaker, Dr. Stacy D'Andre, trained in medical oncology, excuse me, and hematology here at Mayo Clinic in Rochester, Minnesota, about 20 years ago. She's practiced in oncology medicine in California for many years and just recently returned here again to Mayo Clinic in Rochester to start the integrative oncology program. She's also an oncologist working with the brain tumor team as well. So with that, I'm going to turn it over to Dr. D'Andre. Welcome.
Thank you. And thanks so much for inviting me today to do this lecture. So today's topic will be an introduction to medical cannabis. And again, just a quick disclaimer. Again, we're not intending any medical advice here. This is really just educational. Again, cannabis is still considered a Schedule I drug and legality does vary state to state. And if you're interested in medical cannabis, again, check with your local process and work with a knowledgeable provider in your state. So cannabis has been around for a long time. The plant actually predates humans, and we've evolved along with the plant. It used to be used for clothing and for rope and food, especially the hemp type of plants that really yield quite a bit of product. Early use in Chinese medicine was used many, many centuries ago. And hemp was extensively used in the 1600s in the New World. But it wasn't until the 1800s that Dr. O'Shaughnessy reintroduced cannabis back into the medical community. And at that time, it was used for epilepsy and rheumatism, different pains and aches. And at that time, people were using it as a tea or tincture form. It really wasn't used in inhalation form. Bayer and other companies, as marketed in this old-timey brand cough syrup one night, and if you look at the ingredients, that must have been one night, very interesting concoction, but it was used in formulations for many indications in about 1/3 of marketed drugs. But this essentially went away in 1937. There was a tax act, it was called the Marijuana Tax Act, and it essentially made cannabis illegal. So all of these concoctions basically stopped at that time. So in the 70s, cannabis was put on Schedule I status. And what that means is that the drug really has no medicinal value. It is ranked up there with heroin and LSD. And which is kind of confusing because we're using it medicinally and it's legal medicinally in many states. So the legality of cannabis is extremely confusing. and changing. So so keep an eye out for what's happening in your local region, but also federally. So in the 1990s, this was a major discovery. They discovered brain receptors for endocannabinoids. And we learned that there's this whole system in our body called the endocannabinoid system. And so I'll touch on that a little bit coming up. Now, in 2012, Oregon, Washington legalized recreational use with other states to follow. So in California, shortly after that, we did have a recreational use, and it was extremely well utilized in California. And then today, there's still limited research. Despite all of this progress in terms of legalization, we still have a very difficult time conducting research. And that is because of Schedule I status. In order to conduct research in this country, if you want to do a clinical trial, you have to have a special license. You have to get product from the government. It has to come from certified NIDA growers. And it's very, very cumbersome. So most of the human data and trials actually are coming out of Europe and Israel. And we'll touch on a little bit of that coming up. A little bit about the biology of the plant. So cannabis is extremely complicated, has many, many components to it. There are over 100 phytocannabinoids present in the plant, about 40% of which is cannabidiol, or commonly known as CBD. THC is another endocannabinoid, and THC acts on specific receptors in your body. These receptors are found all throughout the body, in fact, in all mammals. So this has been around, this system has been around for a long time. So the two main receptors are called CB1 and CB2. CB1 receptors are found in the nervous system, especially in the brain areas of memory, pain, emotion, and movement. Interestingly, they're not found in the area that controls breathing, and we'll talk about why that's important. Now, it's also interesting that CB1 receptors are 10 times more prevalent than opioid receptors in your body. So fascinating system. CB2 receptors are found mostly in the immune system cells of the body, widespread. So what is this endocannabinoid system and what does it do? So this system is composed of the endocannabinoids, so some chemicals, which I'll go over, and also the receptors. Now, these chemicals that we have in our body, they're very similar to CBD and THC, especially THC. And they play a role in appetite, blood pressure, bone growth, immune system, inflammation, pain, memory, reproduction, and muscle tone. So this is a widespread ancient system in our body. And this is a recent discovery, or in the 1990s. So it's really amazing that this has just been discovered, and we're just scratching the surface in terms of what does the system do and why is it important. So here are the two main endocannabinoids. There are others, and again, they're learning more about this all the time, but two of them include 2-arachidonylglycerol, which is the most abundant endocannabinoid. It binds to those CB receptors in your body, and again, it plays a role in the immune system, pain, and appetite. Anandamide is very similar in structure to THC. So this is floating around in your body, and it's responsible for the bliss or runner's high that people feel. It's also found in chocolate, which is maybe why we like chocolate so much. It also plays a role in pain, appetite, memory, reproduction, and sleep. So there is a theory that in certain disease states, we have dysregulation of our endocannabinoid system. So either there's something wrong with the levels of endocannabinoids in our body, or there's something wrong with the receptors, or our body is not clearing, or maybe clearing too much of these endocannabinoids. So this dysfunction may be associated with these disease states, especially neurologic issues such as Parkinson's, Huntington's, glaucoma, but even in common things such as metabolic syndrome, diabetes, hypertension, anxiety, depression, PTSD, schizophrenia, fibromyalgia, chronic fatigue syndrome, migraines, fertility problems, neuropathic and other pain syndromes. So we're learning more about this and how can we improve our endocannabinoid system in terms of treating disease. There are things that we do know that modify our endocannabinoid system. So things like NSAIDs, like ibuprofen, acetaminophen, they can block the breakdown of endocannabinoids. So by raising the levels of your endocannabinoids, you get pain relief, which is an underappreciated mechanism that these can work. Exercise, we all know, people feel better when they exercise. Well, it increases the expression of your CB1 receptors. Social play increases our endocannabinoids in the brain. Alcohol does the opposite. So alcohol actually dampens down our endocannabinoid system. And two common things in our diet, turmeric and black pepper, they also augment our endocannabinoid system. So let's move on to talk about some of these cannabinoids. So CBD and THC are the most common cannabinoids that you hear about in the plant itself. Now, CBD is just everywhere on the market now, and usually that's coming from hemp. So we'll talk about that separately. But this is from the whole plant. You're getting these cannabinoids plus other cannabinoids as well. So what does CBD do? So CBD by itself may have a role in anti-anxiety, anti-seizure, it's neuroprotective, and has anti-inflammatory properties. It can penetrate through your central nervous system, but it really doesn't bind to those CB receptors that THC does. In fact, CBD has over 65 molecular targets that are listed below, and it's an incredibly complicated system. CBD may calm down the effect of THC. THC is what most people are familiar with, and it's responsible for the psychoactivity of cannabis, the euphoria or high that people feel. However, it has many other functions and effects on the body. It does function as a muscle relaxant. In animal models, it has anti-cancer properties. It has anti-seizure properties, plays a role in nausea or anti-nausea. It lowers blood pressure. It can be bronchodilator, so opening up the bronchioles, pain modulator, anti-inflammatory, and others as listed. Now, not only in the plant is there THC and CBD, there are other minor cannabinoids, and it seems like they're discovering new ones every day, and they all are a little bit different. So the plant, again, is so fascinating. It has so many parts to it that we're just really starting to learn about. So a couple of these minor cannabinoids include CBN. This is a stored or degraded product. So as the product becomes old, its cannabinoids can kind of degenerate into CBN, and this can be really a sedating type of cannabinoid. So you'll see that marketed in some of the sleep remedies and type of things. Some of the other cannabinoids, minor ones, include CBC and CBG, and these may play a role in pain and anti-itch and anti-inflammatory. Now, it's important to remember that in the synthesized version, so the type of cannabis that you get from a prescription, you're not getting these minor cannabinoids. You're just getting an isolate or a synthesized version of a cannabinoid. So many people who are advocates of plant-based medicine feel that you get more out of the actual whole plant extracts. Cannabis seems to work very well. It's called the entourage effect, where you have all of these things present in their natural form. They work together. And so that's been actually studied in animal models, and it seems to be the case. And again, as I pointed out, other things can interact, natural things that we utilize. So chocolate, capsaicin, turmeric, those also can interact with our endocannabinoid system. So there is a raw form of cannabis that most people aren't really aware of. And so before you heat the plant, there are these raw cannabinoids, and they are an acidic form. When you take the plant and you heat it, it changes it. So for example, CBDA is the acid form of CBD. And this raw form has different properties. So many people will use the raw plant, they'll actually juice it or just have it in the raw form as an anti-inflammatory. CBDA may have a role in anticipatory nausea and vomiting, which is something in the world of cancer is a problem. There aren't really good medications for that. But that's only been studied so far in rats. So we don't have a great human data yet in terms of if it works in people. And again, in animal models and cell culture models, there is some anti-cancer effect from these type of cannabinoids. Terpenes are another component of the plant. So terpenes are a class of compounds that are produced by plants. And the reason they do this is to protect themselves. So these cannabinoid or these terpenes give the plant its characteristic aroma or flavor, and they detract herbivores and parasites, basically. Now, terpenes can either be activating or sedating, depending on the type of terpene in the product. And some products are marketed for this reason. So things that are more sedating may have more myrcene or lavender type of product. And here are just some of the examples of some of those terpenes. So myrcene is a very earthy flavor and aroma. It's very relaxing. Linalool is from like lavender. It also is very sedating and anti-anxiety. Limonene is from like a lemony, citrusy type of terpene, and that's actually more mood elevating, so a little more activating. Pinenes are terpenes that smell like pine or some spices like rosemary, and those are quite activating. And then trans-caryophyllene is a terpene that is kind of peppery, and that may play a role in pain and anti-inflammation. So the terpenes are another whole component of the plant that go into how it may work in the body. So again, increasing the complexity of this plant. So what is the difference between hemp and cannabis? So this is a super common question. So basically, they're both cannabis. They're both part of the same family. They're just different types of plants. The hemp plant is very tall. It has a very long stalk, and it doesn't have as many flowers. So you see more stalk and less of the flowering product. Now, hemp is used as a scavenger plant. So they use it to help clean up toxic sites. You know, it sucks up a lot from the ground. And for that reason, it can have more contaminants in it. And you need to use a lot of hemp in order to extract the CBD. So what you're getting from hemp is mainly CBD. Now, the problem with hemp products that are marketed online is they're often mislabeled. And one study showed up to 70% of products that were obtained online were mislabeled, meaning they either didn't have what they were supposed to, or they actually had more THC in them than they were supposed to. And that can be a problem if you do drug testing for work and you think you're taking something that doesn't have THC, and whoops, it actually does. So again, hemp products are legal online. You can kind of get them everywhere. State regulations are still pretty fuzzy, especially in states where nothing is legal. So again, need to really check with your state and see what's going on with regards to that. Now, cannabis, the traditional plant that you see has a lot of flowers. It has more cannabinoids in it. So you're getting THC, CBD, and a lot more of those minor cannabinoids. It's more potent. You get more of that entourage effect where all of the plant is working together. There's less contamination because you don't need to use as much product. And again, it's still Schedule 1, so we have to get our products through dispensaries. However, when you do that, you're getting a clean product because they have to test these products for purity, for exactly what is in them. They test them for contamination and lead and heavy metals. So that is why many of these products at the dispensaries are so expensive, because there is a lot of quality control. But again, you're getting a high quality product. So a little bit about how cannabis is taken. So there's many ways to take cannabis, and these all can be useful depending on what the indication is. So inhalation is, kind of the more known route, mainly just because of recreational use. It is the fastest onset. People either vape or smoke the flower. Juicing is when you're actually taking the leaves from the plant and literally just grinding them up and juicing them. And that's where some people get that raw or acid form of the cannabinoid. Oils are called full extract cannabis oils. They are pulling out basically, mostly these are high THC products, and some people may have heard of Rick Simpson oils, extremely potent, really thick, tarry stuff. Is very hard to titrate. And sometimes they'll tell people, oh, well, you take a grain of rice size. So what does that really mean? It's very hard to titrate. So I haven't been a super fan of that because it's difficult to measure, especially for people who are new to cannabis medicine. I actually prefer tinctures. These are more diluted. They come with a dropper, with a measuring dropper on it, so you know exactly what you're getting. And it's easier to titrate these tinctures. They go under your tongue. You leave it under your tongue. It's called sublingual administration. They can have an onset of 15 minutes, 30 minutes, but a lot of people don't really hold it under the tongue and they swallow it. So then it really it's more like an oral onset, which takes longer to absorb into your body. But they don't work right away. So that's an important thing to remember. Now, edibles are, things that come in a pill or a chocolate or a gummy bear or some form of an edible that you're actually eating. And that can absorb over 1 to 2 hours. So very slow onset, but the effect can last for many, many hours. So some people really enjoy using edibles at nighttime for some of the benefits for sleep and pain because they last for a very long time. Some people will use suppositories. It's really, really controversial. They may not be really well absorbed, and it's not a form that's commonly recommended. There are topical cannabis products. So you may have seen CBD creams or CBD THC creams, and some people use those for arthritic pains, kind of aches and pains, that type of thing. And then there are transdermal patches, and those are quite expensive, but just another alternative method to getting these products into your bloodstream. So a few more words about the way that you take cannabis. So again, oral absorption is highly variable. And what's interesting is that how you feel after you take an oral product is different than how you may feel if you inhale the product. The metabolites, how your body processes the cannabis, when you do an oral product, they can be highly psychoactive. So some people don't like that and they prefer inhalation. So it's highly variable how your particular body metabolizes these products and what effect you feel from them. Again, oral absorption can take many hours to reach peak levels. It can affect the enzyme system, and we'll talk about how that may interact with some drugs. And these cannabinoids are stored in the fat and they're released at very low levels. So they can stick around for quite a while. Tinctures, again, they're diluted, often from an alcohol extraction. They are faster onset, but again, many people are just swallowing them. Inhalation, again, takes only a few minutes for peak levels, but then they decline more rapidly. So they're good for things that you need a very quick onset, but it doesn't last very long. So many people might use an inhalation route for nausea because it'll work quickly. Here are some drug interactions. So, cannabis can affect the liver enzyme system, which is responsible for our metabolism of other drugs. So there can be drug-drug interactions. Coumadin or warfarin, some specific seizure medications, not super common, but they can be affected by cannabis. And then statins at higher doses. Some antibiotics and antifungals and blood pressure medications can their levels can be changed by patients who use cannabis. So it's always important to check with your pharmacist and your doctor to make sure there are no interactions. And if there are, you need to really work with a knowledgeable provider to make sure that you're, safe if you're using cannabis medicine. Some other interactions to be aware of. So an interesting interaction is, I think, a good one. Patients who are using opioids, oftentimes, if they are using cannabis, they're able to reduce their opioid usage. And in some studies, they actually can stop their opioids. So this is under intense study because of the opioid crisis. And, a lot of people think that cannabis medicine may be a way to help people get off of opioids. Now, we talked about how there are no CB receptors in the brainstem, which is a good thing. So the risk of overdosing from many drugs, when you're taking opioids and other benzodiazepines and other things, they decrease your breathing. And that's why people overdose, is because they stop breathing. So cannabis doesn't affect that center in the brain. So it's safe with regards to that. Now, there can be excess sedation, however. So if you're using alcohol or any kind of Ativan, benzodiazepine like Valium, there can be a lot more sedation if you're using them together. Also, anticholinergic drugs, so I listed them below, but common things like Benadryl, Wellbutrin, Atrovent, those are called anticholinergic drugs, and they can increase the psychoactivity of cannabis. And stimulants, those may also increase paranoia and psychiatric side effects when using cannabis. So just a few things to keep in mind with other drugs that may interact with cannabis. So why are we using cannabis? So the National Academy of Sciences report in 2017 found conclusive and substantial evidence for cannabis use to treat chronic pain in adults, as an adjunct for nausea for patients on chemotherapy, and for multiple sclerosis spasticity. There are prescription cannabinoids available, and these have been around actually for a long time. Marinol is a synthetic THC. It's been around for many, many years, and we have used it for nausea and for appetite stimulation in cancer patients. Nabilone, also a synthetic THC. Sativex is a product not available in this country, but in Europe and in Canada, it is a plant extract. It's a 1-to-1 ratio that is used for many indications, including cancer pain. Syndrose is a liquid synthetic, again, used for chemotherapy-induced nausea and vomiting and for anorexia. Now, these synthetics are not widely used because a lot of people don't like the side effects because it's just THC. And so it's really not like what is in nature. So they're not really widely used. Now, Epidiolex is the first FDA-approved drug that contains, it's plant-based. It's a plant-derived CBD, very high dose oral solution that's used for children with these rare forms of epilepsy. This is just a study, moving on to some of the indications for use of cannabis. This is a typical study done in the cancer arena. This was a large study, almost 3,000 patients were followed. 80% had severe pain and insomnia. These patients were given product, either THC or THC with CBD. And they found that many patients at 1 month, 66 reported an improvement in their symptoms. And at 6 months, the majority were still using cannabis and were still reporting improvement in their symptoms. Their quality of life improved, their pain improved, and they also reported improvements in sleep, fatigue, nausea, anxiety, and depression. And in this particular study, 36% of the patients actually stopped using their opioids. Again, there were some side effects. These are common, manageable. A few patients do stop using it because they don't like the psychoactive effect, but you can see the percentages are pretty low, and we'll talk about side effects in a few minutes. Now, this is kind of a typical study where patients are given cannabis and then you kind of see what happens. However, randomized trials in cancer pain, they really have been poor quality. There was a meta-analysis done where they basically said, we really can't make heads or tails of the data. They said that in this particular meta-analysis, it is unlikely that cannabinoids or cannabis will reduce pain for everyone. They may work for a small number of people under close supervision of specialists. However, we do need more clinical trials done using products for the treatment of pain. So what about anxiety and sleep? So for anxiety, CBD has been shown to be helpful in a variety of situations. The dosing of CBD is highly variable, much more so than THC. So CBD can also reduce the side effects of THC. And that's why many patients really do like a combination of CBD and THC together. And for anxiety, if CBD alone is not helpful, sometimes a little addition of THC can be useful. Now, sleep, studies have shown an improvement in short-term sleep outcomes in individuals with sleep disturbance associated with obstructive sleep apnea, fibromyalgia, chronic pain, and multiple sclerosis. And most of the studies do use THC. Again, you have to be mindful of the side effects of THC, especially if you're doing an edible or a tincture. It can be long-lasting through the night, which can be beneficial, but you can kind of wake up sometimes a little bit groggy. I have many, many patients that are taking CBD alone for sleep because it's easy to get. You can just get CBD anywhere. The problem is it doesn't work. So CBD alone may actually impair sleep. CBD alone, especially at lower doses, is actually activating. But it can help if anxiety is the main reason why you're not sleeping. So it's important to, again, why are you using cannabis, and what's the underlying problem? Is it anxiety or is it just insomnia? Again, the terpenes are important. And again, certain products have terpenes that are designed to help with sedation. So things like lavender or a little bit of CBN or myrcene. So the terpene profile and the cannabinoid profile is important. With regards to nausea and appetite, the studies have been pretty mixed, at least in the cancer area. Different products have been tested, different settings, makes the studies really difficult to interpret. Many of the studies have been done with synthetics, so we don't have a lot of data on just plant-based products. And again, the synthetic products are widely available but rarely used. And most of the literature would suggest that, it can be useful as an adjunct for nausea that is not being relieved by standard antiemetics. Our nausea medicines these days are really good. And so many patients, they don't need to go as far as using cannabis because it can be managed with other medications. So I get this question probably on a daily basis. What can I use to treat my cancer? Can cannabis treat my cancer? And the answer to that is we don't know. Now, if you're a rat or a mouse, you may be in good luck because there are many animal studies and cell culture studies that do show that cannabis does have anti-cancer activity. Both THC, CBD, and the combination have shown activity. However, it depends on the cancer type, and it even depends on the specific where that cancer came from, the particular patient that it came from. It can vary. You can have two different patients with breast cancer and they make a cell culture from that cancer, and it will respond differently to different products. So it's extremely complicated. There's very little human data. So we just don't have any clinical trials, really. There's a tiny study done in the UK on brain tumor patients. It needs to be replicated, and they're actually working on that right now, getting together a larger brain tumor study using a one-to-one product. But we just do not have, good clinical trial data on whether it can treat cancer. And that will probably remain that way until cannabis is deschedulized and we can make research more accessible. And I think that needs to happen in order to move forward. One little point I'd like to make about immunotherapy. This is a recent study out of Israel, and they showed that patients who are using cannabis that are on immunotherapy had worse outcomes. So I do point out to my patients that are on immunotherapy, until we know more, I would suggest not using cannabis, or at least using the lowest amount possible. Fortunately, with immunotherapy, we don't get into as many of the side effects as we see with chemotherapy. But until we have better data on the effects of cannabis on immunotherapy, I do tell my patients about this study. So how do we dose cannabis? So the golden rule is to start very low and go very slow. THC is limiting. So if patients go too fast and they take too much of a product that has THC, they're going to know it and they may never want to do it again. And that's not the way we want to do this. We want to start with a very tiny dose and slowly titrate that up. Many of my patients will start with dosing them at nighttime, and slowly increase to where they have a therapeutic effect. If needed, depending on what the problem is, sometimes we add another dose in during the day. And I have my patients journal the effects so they know kind of what's going on. They can document the dose and what side effects they're feeling, and stop when they achieve a therapeutic effect. More is not always better, and more can get you into more side effects. Again, the dosing is so highly variable, especially with oral edible products. It's really important to work with a knowledgeable provider. Inhalation can be useful for breakthrough symptoms or for something that you need a quick onset of action for, like nausea. So when you do go to a dispensary, there are many, many products. It can be overwhelming. Even in the state-run centers where product is, still somewhat limited, they still have a lot of products in there. They have different ratios. So a very common thing that you will see is CBD THC, and it will say like 1:1, or it will say 2:1. So what they're talking about is 1 part CBD to 1 part THC, which can be very broadly useful. Now, for people who are sensitive to THC and don't really like the effect of it, you can find a product that has a higher amount of CBD. So that would be more like a 5:1. So 5 part CBD to 1 part THC. And if you're extremely sensitive to THC, you could go with an even higher CBD product. Now, CBD, again, by itself may be useful for anxiety, maybe pain. At low doses, it's been useful for just clarity and well-being, all the way up to very high doses, the Epidiolex product being useful for treating epilepsy in children. Again, the main question that you should ask and your provider should ask is, why am I using cannabis? What are my problems that I would like to treat? And then that will point you to the particular product and the way that you use cannabis. So it's very, very individualized. And it takes some trial and error. It's not one size fits all for sure. So here are some of the side effects of THC. So you can have lowering of blood pressure, you can have a fast heart rate, you can feel thirsty. Some people feel euphoria. I don't know if that's a side effect. That's probably a good thing. But other psychoactive effects like paranoia and some short-term memory loss can occur. Spatial perception alterations and feeling disoriented, feeling drowsy, red eyes, bronchodilation, constipation. THC is a muscle relaxant, so kind of like lowering of the motor tone, so your muscles are more relaxed. And that could be a problem potentially for older folks who are a fall risk. Again, dizziness and even nausea can occur at high doses. Patients do develop tolerance to THC, so you need higher doses over time sometimes. And again, THC can interact with your liver enzyme system. Now, there is some dependence seen with THC. However, it's much less than with benzodiazepines or with opioids. There also is withdrawal. Now, the withdrawal from cannabis is typically mild, and most people liken it to caffeine withdrawal. So you can have some insomnia, be irritable, nausea, restless, and it dissipates after a few days. And the reason that it's not a horrible type of withdrawal is because, again, cannabinoids are stored in your fat. and then they're released at very low levels over time. So you have a gradual decline in the levels of cannabinoids in your blood. And again, there is an addiction potential with THC or cannabis, but it is a low percentage, especially in our medical patients. We are careful in those with a psychiatric history or those with a history of substance abuse. CBD, does have side effects. It's everywhere. You can just buy it anywhere online, but it can have side effects. So at low doses, actually can be activating. At higher doses, fatigue, diarrhea, weight changes. It can change your liver test. We get liver test abnormalities on your blood tests. In the Epidiolex study, the high dose, they found that the high doses were associated with fatigue and anemia, diarrhea, and feeling jittery. And there are about 5 to 10% of people out there that are extremely sensitive to CBD. So again, trial and error, very individualized in terms of how CBD affects people. Here are some precautions. So we don't use cannabis in active cardiac patients because especially the THC, especially inhaled THC, can drop your blood pressure and increase your heart rate. So that's not something that we want in somebody who has active coronary disease. There is a fall risk in elderly patients, especially in the first few weeks. So now they have done studies and cannabis can be useful for even very elderly patients, but you need to be extremely careful because of the dizziness and sedation, and it's preferably have somebody with you if you're an older patient. We don't advise driving. We don't don't want people to use in pregnancy, avoiding use in patients with psychiatric disorders or addiction disorders. Avoid use, especially the inhaled form, the actual flower, in those that are severely immunocompromised, because some of that can have mold contamination, and we don't want mold if you have no immune system. And again, as I showed, at this point, I'm telling people who are on immunotherapy, we should probably not use cannabis, or at least keep the dose extremely low, because we want to have our immunotherapy work as well as it possibly can. Again, remember the drug interactions, especially Coumadin, specific anti-seizure medications, especially with higher doses of CBD. Again, check with your pharmacist. We do not see a lot of significant drug interaction, but it's always important when you're starting new drugs and with cannabis to make sure there are not going to be any adverse interactions. So in summary, most important question, why are you using cannabis, or why do you want to use cannabis? So this will help your practitioner point you towards the right product, the right ratio, and the right route of administration. And again, remember, it's a trial and error process. We always start very low and go very slow. Another important question is, have you ever used it before? How did you react to it in the past? So many people have used it in their youth and they really liked it or they really hated it. And that's important, because if you liked it in the past, chances are you will like it again. If you had it, some people had, if they tried it when they were younger and they got kind of paranoid, or, just didn't like that feeling of THC, well, then you might want to choose a product that has more CBD in it. So more, higher ratio of CBD to THC. So that's an important question, I think, to ask. Always remember medication interactions, be mindful of them. Remember the precautions that we talked about. And again, the golden rule, start low, go slow, keep a journal, record your side effects, and titrate to where you're feeling some benefit. So I know this was a whirlwind through the cannabis journey here. And I hope that was helpful for people, at least as an introduction. I've been using cannabis medicine in my practice in California for many, many years. I've seen the benefits. I really hope in the future that we can get some great clinical trials going. That's what I'm excited about being back at Mayo Clinic, is to really do some high quality research in this area. So with that, I thank you for your attention, and I'm happy to take any questions.
Well, I'm just going to jump in and say that was excellent. Excellent presentation. Thank you so much. I learned so much from this, so I really appreciate it. And I know there are some questions coming in, but maybe I'll start off with a couple I have real quick.
Sure.
So you had mentioned something about you can build tolerance. So people who are taking this for pain or whatever reason, they build tolerance and then they need an increased dose. Is that common or frequent?
Yeah, it over time that can happen. So in my experience, it's not that you have to go up a tremendous amount though. So I've had patients on, for example, they were on maybe 10 milligrams for pain at night and it just wasn't quite doing it. So they went up to 15 and then 20, but it wasn't, they weren't increasing it by huge amounts. But it can, over a long period of time, you definitely do develop some tolerance.
Okay, great. And then for people who want to try CBD, you had mentioned that it's hard to make sure you know that the product is safe or has what it says it's in there. Any guidance on how people might go about that?
So if you are in a state where cannabis is legal, you can get high quality CBD products at a dispensary. So that's going to be your best bet because it's tested, you know exactly what's in it, highly regulated, a little, it's expensive, but it's worth it because you're getting what you're paying for. There are companies out there online that do sell CBD products. I would investigate that company. I would look for, good manufacturing process. I would look for, whatever you can find in terms of their quality control before you just buy some product on Amazon or anything like that. So I would research, companies and make sure that they have good manufacturing product.
Okay, great. I'll turn it to Megan. I think she's been looking at the question.
Sure, yes. So here's a question. If I have understood correctly, THC is also beneficial for patients with epilepsy, not only CBD. Is this right?
So again, most of the work has been done with CBD. THC does have some anti-epileptic properties, but I don't think it's not as well studied as CBD. So now again, going back to treatment, what is actually approved for use is CBD, and that is only for children with epilepsy. So at this point, there is no indication for using cannabis to treat adults, for example, with epilepsy.
Okay. Another question, in a small percentage of people, I have read that CBD can increase the anxiety. If this is one of the possible side effects, could you talk about that?
Yeah, so again, about 5 or 10% of people are really like hypersensitive to CBD. And so if they're using CBD for anxiety and that happens, again, some people will add a little bit of THC and see if that helps them. And again, pointing out that cannabis medicine is challenging because how it works for one person isn't how it works for another person. And for a particular patient who has anxiety, CBD can be extremely helpful. And for another patient, it either does nothing or they don't like it. So it's this wide variety of effects that you can see. And it all comes down to like, how does your body metabolize it? Like what's happening in your own individual body and the effects that you see from using cannabis.
Sure. Here's a question. Can you schedule an appointment with doctors at Mayo Clinic if you're interested in starting?
You can. So our, again, there are doctors at Mayo that are, that will certify patients for cannabis in the state of Minnesota. So again, this is a state by state deal. So if you are in Arizona or Florida, there are physicians in those states also that can certify you through the state program. For example, in our practice, many of the oncologists will certify our patients for medical cannabis. My particular practice is in brain tumors and also in the integrative medicine field. So many of the integrative doctors are also involved in this. So not every doctor is knowledgeable. Not every doctor, anywhere really has gone through training. So you kind of have to ask around and find physicians that can certify you in your given state.
There's a couple questions that are geared to a specific symptom or disease entity. So they're wanting your thoughts on, would this work for overactive bladder, Parkinson's, and or chronic bronchitis? I've quite a few different questions in there. So
yeah, again, there's anecdotal stories out there for all of those, but nothing, there's no great clinical trials that I'm aware of. And I have to qualify that and say, I'm a cancer doc. And so my expertise has been in the use of cannabis for cancer and cancer related problems. I do know that, a lot of people have been using cannabinoids for fibromyalgia, chronic fatigue, and there has been some research done in Parkinson's. That's just not really my field. But you could ask a neurologist and do some research on that.
Here's one in regards to clinical trials. Are there clinical trials somewhere that have given statistical efficacy in patients using CBD and THC? Is there a way to measure the effects, or is it all subjective?
Read the first part again.
Are there clinical trials somewhere that have given statistical efficacy in patients using CBD and THC? Is there a way to measure the effects, or is it all subjective?
So a couple points. So if you're treating symptoms, then it's going to be subjective. So if you're using cannabis for, let's say, pain, it's going to be subjective. So whereas if you're using cannabis to actually treat cancer, then you may have objective evidence that it's doing something. And that's where we're lacking the data. But again, in Europe, they're doing studies in brain tumor patients where they're giving CBD THC and they're looking at their scans and monitoring, hey, are we seeing an increase in survival time? So they're very objective data. So it really depends on what are you studying? But the majority of symptom management, that's very subjective data.
any thoughts on, I know this isn't your field either, but someone's asking in terms of you've read or learned anything if it's been utilized, either CBD or THC, for autism patients?
Have not. Not a little out of my wheelhouse.
Question, does it work for restless leg syndrome?
Again, I have seen some reports on that. I haven't seen any great, clinical trials. I mean, there's anecdotes for everything, right? So you can find a story, you can find a case report. So it's hard to say for sure, but I can say that, CBD and THC both have relaxant properties. So I have had people with like fibromyalgia, restless leg, pain syndromes where they have that chronic pain loop. And they've used cannabis and it seemed to help them, especially at nighttime, kind of calm down the muscles, kind of help them sleep. In my experience, cannabis has not been, it's not like a pain medicine, it's more like a modulator. So it changes your perception of pain and it changes your perception of things. But also there are all those other secondary properties like asking about chronic bronchitis. Well, THC is a bronchodilator. So does that, turn into an improvement in chronic bronchitis? I don't know, but there is a mechanism behind it. It does have a lot of other actions, and muscle relaxant is one of them.
Here's a question. Will it work for peripheral neuropathy as related to multiple myeloma or just peripheral neuropathy in general? I'm wondering.
There is some data, and one of the things from the bodies that study, and make recommendations is that it may be useful for peripheral neuropathy. So that's one of the pain syndromes where cannabis may be useful. They've studied it in inhalational form. That's been the most studied in terms of treating peripheral neuropathy. We're actually hopefully launching a clinical trial here soon on cannabis creams. So using a topical cannabis to see if that helps with peripheral neuropathy that's been induced by chemotherapy. So I think more to come on that, but I think that there is some rationale and some evidence that may be useful.
Sure. How does CBD and THC affect immune compromised patients?
So in terms of lowering or worsening of the immune system, I haven't seen any data in terms of that. Now, when I was mentioning immunotherapy, that's different because when you're on immunotherapy, you're taking medications to ramp up your immune system, right? So you're kind of artificially elevating your immune system to fight cancer. And cannabis what cannabis tends to do in the body is it tries to maintain what we call homeostasis, or it tries to achieve a balance. So if something is out of balance, it's going to try to make it in balance again. And so, for example, if your immune system is upregulated, it's possible that cannabis then sort of down regulates that. And that may be why we're seeing lower responses with immunotherapy. But if you're immune compromised, I would say, my main concern would be you don't want to use products that are potentially contaminated, because you don't want to get some sort of bug or mold or something like that and develop an infection. And that is most common with like flower and inhalational. They found mold growing on some of the cannabis. So that would be my main concern if you're immunocompromised.
Sure.
Lots of questions here. It's hard to sort of sort through.
I know. I was
already
thinking
answered or not.
We kind of are starting to come to the top of the hour too. So may have to halt the questions here just in the interest of time, but do want to say that some of the other comments that have come through are just that this was a very helpful and informative presentation. So we do want to thank you, Dr. D'Andre, for sharing your information and research that you've done and knowledge on this topic.
Sure.
Yes,
it's been great.
It was wonderful.
All right. So we'll remind people, I know some people have asked about recording this session. We do have it recorded. It does take us a little bit of time to turn it around and post it on Mayo Clinic Connect site, but we will hopefully have that available to you in the next day or two. So want to thank you for joining us today, and thank Dr. D'Andre for giving us her time this morning as well.
Thank you.
Thank you.
All right. Take care. Have a good day.